My name is Dr. Kim Cavanagh. I am the Program Director and Department Chairperson for the Gannon University Physician Assistant Program in Erie, Pennsylvania, and I've been involved in PA education since 2001. The COVID-19 pandemic definitely impacted both our didactic and clinical education here at our program, just as it did other programs, other educational institutions, and really everybody throughout the past several months. We definitely had to think about how to really reimagine the remaining part of the clinical year for our class of 2020 students. So our program typically graduates students in August with site suspension beginning in March. We initially thought it would be short-lived, so we developed some enrichment and supplementary activities for students, but as it became apparent that it would be longer before students could return to clinical site, we started to develop individualized student clinical experience plans, which worked and helped us identify what outcomes, both course outcomes as well as program outcomes, course requirements, program requirements, graduation requirements that each individual student needed to meet so that we could verify that all of that was happening for each student. This involved us, putting together some indirect patient care experiences through the use of virtual case and virtual patient resources and allowing us to use some simulated patient experiences for our students. Those were directed towards those students' remaining clinical experiences so that they were really ready once they could return to direct patient care experiences. They were really ready and comfortable with that content, even though there had been a pause in their education. We did feel strongly about, continuing our assessment structure. Again, while we had to shift to more of a remote delivery, continuing our assessment plans for students was important to make sure, again, that they were meeting stated outcomes. So this would include knowledge-based assessments and then skill-based assessments in preparation for their graduation. As talking with students across our program, I think one of the things that's become apparent is their ongoing desire or even additional commitment to care for patients. I was so impressed with the resilience and professionalism, particularly of our clinical year students, really of all of our students, but our clinical year students whose clinical experiences were paused as they were, reaching the finish line, and they were dedicated to doing what needed to happen and really committed to entering the workforce. But we've seen those similar kind of sentiments expressed from, students across the 5 years of really just, I think, reaffirming the decision to become a PA.